So, Dr. Chang, lung cancer, it's one of the deadliest forms of cancer. What can people do to prevent getting this terrible disease?
You're absolutely right. Lung cancer is the leading cause of cancer mortality in this country for both men and women, and that's been true for decades. The single most important risk factor is smoking, and it accounts for approximately 85 to 90% of lung cancer victims. Smoking is, to put it another way, 30 times more risky in terms of causing lung cancer than in a non-smoker.
Okay, so the vast majority of people who get cancer are smokers. Are there any other risk factors that people should be aware of that might cause lung cancer?
There are other risk factors. There are approximately 15% of lung cancer victims who have never been smokers. In other words, by definition, they have never smoked 100 cigarettes in their lifetime. For these people, we're concerned about other risk factors, but we can't forget the presence of secondhand smoke. Secondhand smoke is difficult to actually quantitate, but we think it plays a major factor in those 15% of never smokers who develop lung cancer. In addition, there are other risk factors. For example, in certain occupations, asbestos is a problem. In heavy metal manufacturing, nickel, chromium, and metal fumes are problems. In the households in certain nations, cooking on non-ventilated wood-burning stoves can be a problem. But a recent problem that's being controversial is that of radiation imaging. And so approximately 50% of the radiation exposure in this country is now in terms of medical imaging. It's difficult to actually calculate how much risk you have with a given procedure. We have to extrapolate based on the atomic bomb survivors from Japan, realizing that certain people with a small dose of radiation who lived around those areas developed cancer over the 60-year period they were being watched. So that we can extrapolate and come up with statements such as, if you obtain a CAT scan yearly for 30 years, your projected increase in cancer mortality deaths is approximately 1.9% over your lifetime. So there is a real, although somewhat theoretical, risk for radiation imaging causing cancer.
Dr. Chang, tell us a little bit more about who should get a CT scan and what that has been, how that has helped with early detection in those who might be at risk for lung cancer.
There have been some recent studies in the past year, large studies called the National Lung Screening Trial, where high-risk individuals, those who smoked the equivalent of 1 pack per day for 30 years, were selected and studied comparing annual chest x-rays with low-dose CAT scans. And they did find a benefit in terms of decreasing the amount of deaths due to cancer and overall deaths because they were able to pick up lung cancer earlier. It is now being concluded based on these recent studies that high-risk individuals should discuss the risks and benefits of cancer screening with their own personal physicians in order to determine whether or not they should undergo a yearly low-dose CAT scan screening.
In addition to smoking, there may be some diseases that also can create risks of lung cancer. Would you elaborate a little bit on that?
Yes. Chronic obstructive pulmonary disease, which is related to smoking, and interstitial lung disease, which is a progressive scarring of the lungs, have an increased incidence of cancer, even if you separate out the smoking details. So that those people have to be followed for possible lung cancer as well.